So, good evening, everyone. Am I audible?
Yes, doctor, you are.
Yes. Thank you so much. So, in this section, I am going to deal with how my experience in various treatments, modalities, and the intelligence of brain, how it acts. So, based on that, this is my own experience. So, I am sharing with you. So, how and all. So, coming to the screen share, so that you will be more understanding the things. Yes. Okay. Done. So, are you able to see my screen now? Are you able to see my screen? Hello? Am I audible? Hello? Getting me? Shall we start? Anyone, please reply.
So your audio is getting cracked.
Audio is cracking. Okay. So, am I audible? Audible, okay. Are you able to see my screen?
Yeah.
Okay. So like first thing, what is pain? Pain, we have got three modalities, like how and all it passes, you are knowing well. So I need not to emphasize on all the anatomical, physiological aspect. So this how the pain transmits, which are the ways. So one is we call as tissue leveler pain. When tissues are getting damaged, so it creates some sort of pain. Just for example, kidney stones or tumors. So it triggers a pain. So later on, that is being recognized by the anterior lateral pathway of the spinal cord, and this is transmitted into the somatosensory cortex of the brain. So there are three ways of perception of pain. So that is being relatively perceived by us. So what is happening means, so the perception of pain varies from person to person. Like, if he's a soldier, he has got more perception of pain. He's like, he set his mind in a more superior way, that however, if an enemy attacks, so it will not disturb him anymore, because that is the perception of pain. So coming to next point. So like, I told you there is different ways of pain that which is been just I have written it, and you can go through it. It's not my point of view. All the things, just I'm brushing a bit up. That's it. So what I would like to tell you is that, so there are three steps, three places of pain. That is tissue pain, as I told you, like if it is affected in a different organs. Spine side, that is where there is a compression in the spinal column or in anatomical changes. Second thing, and that is the brain side. That is, so where like the problem goes, and from where we perceive the pain and it exhibits. So however, the pain has removed also, the memory of pain will create a pain. So we can see in a few patients, however, what are all the examination you do it, everything is fine, still what is happening, the person keep on feeling the pain. Okay, so that is the thing, it's a memory of pain. So that could be like, if you want to take out that pain, if you know the art of hypnotization, you can take out that pain. And also you can ask, like while patient is walking, if he had a disc sleep, if he has the memory, what will happen, automatically he starts limping it. So this is the memory, so it has the ability to reconstruct whatever the disease was in the previous also. So one thing, it's very clear, three sides of pain. Is it clear now? Any doubt in this thing? Are you able to hear me? Is it okay? Okay, done. So coming to next thing. Next slide. It's not coming, right? What is happening? Yeah. So what are all the changes are possible in these places? These three places. Now we have to understand what is the possibility of changes. So physical changes like anatomical, structural changes. In, for example, spine, you can see lordosis, kyphosis, scoliosis, okay, degenerative changes. Okay, so all the things that which could be visualized under MRI, CT, X-ray, with whatever all the methodology or just feeling you are able to understand. So that comes under the physical change. That is a changes practically, like if you are speaking about in your organ hypertrophy or example hypercalcification of the arteries. So these are the things which is more visually what you are going to see. So in Ayurveda there is one saying, pratyaksham hi alpam. That is, whatever you see in pratyaksha, naked eyes, is only alpam, is a small thing. What are you are not able to see is a larger what you call scope area. So that if you are able to analyze, so we'll get some more points. Next, what is the possible changes? Chemical change, like biochemical change in blood, neurotransmitters. So like we can see the elevated bilirubin level, creatine level. So we can see the chemical change. Okay, next coming to functional change, like mental functional changes, like behavior pattern changes, mood swings. So it all things tells you that manas is disturbed here, because you not be able to prove anything like by CT, MRI, behavioral change or mental functional changes, nothing like that, where you will not be able to see, but only able to perceive it by the person action, that is functions. So I think this part is more undiscovered area, because for chemical change you have got blood test and all, anatomical change you have got all the parameters, X-ray, everything. But to analyze the manas, so what is the criteria? So what Ayurveda tells is that, so by feeling the nadi, that is pulse, that is called as nadi pariksha. So we are going to talk it now. So by the nadi pariksha, you will be able to understand the manas of a person. Getting the point? So if you understand the manas, what which is could be a precursor of a disease. Okay, so today one patient came, one boy around about 13 years age. He was complaining of a severe stomachache. The like since 15 to 20 days, the patient has taken CT, abdomen, everything, no problem, but still pain is not going at all. So I examined the stomach, no McBurney's point pain, no appendicitis, no nothing. But still, any problem in spine? No, it's absolutely perfectly all right. But where is the problem then? I felt the finger, there was a depression in the DU20 region, that is the apex of the head. There was a small depression. I found out that this is because of the mental changes. This thing happened. What I simply done was, you can feel that could be a magic or something like that. You felt, you understand, you understood it, and when I felt the pitta nadi, the point where I kept my hand and I felt the pitta nadi, the pitta slowly started to picking up. So now I understood. It's given me a thinking process that yes, definitely there is a changing process in the brain. So there was a depression in the head. Now see, what I have done is that simply what I have done, I felt it as I kept on giving a small pressure over here. and I'm feeling the nadi. So it has it gradually picked up within 4-5 seconds. And when I felt the visceral of the stomach, so stomach actually it was being pulled to the left hand side. That is, as you feel the stomach, you can feel to any patient, it should come in the center. If anything like any viscera has like pulled back to left or right, it means that some problem. In this patient, the viscera was pulled to the left side. After the pitta activation, by the mild pressure over here, the viscera pulled back to its normal place. Then I asked, now where is the pain? Check it out. You run, sit, do whatever you want, you do it. Where is the pain? No, pain was gone. See, where is the pain? The perception of understanding the pain, where is that? So this level of understanding should be there, because whenever we are going for all the investigation, we are ruling out one thing, we are forgetting one thing, we are what? Spiritual, or what you call more of manas oriented personalities. So whatever we think today, that could be of, we will be of tomorrow. So some problems, some blockage to that person, that is that child made to develop, that's scolding of a parents could be. So something that it created a blockage in his mind that created the changes in viscera. So later on, what it could have been led to? That could be led to a anatomical, biochemical change, and definitely later on we'll be able to find it as a disease. So now to understand that, so manas, that is a functional change in our body. Manas is like a software resides in the cells, like just like a DNA or a gene. So manas starts disturbed by kama, krodha, mada, matsarya. That is called as Arishad Vargas. So according to Ayurveda, all disease starts in this way only. So nothing can influence rather than manas. So you are afraid, what will happen? So if you are afraid, what will happen? Your heartbeat starts increasing, adrenal starts start to input in your body. So in what way you can control your autonomic nervous system? Only by controlling the manas, it is possible. So in Ayurveda, we call it as manodosha. These manodoshas are sattva, rajas, and tamas. It has been told that when it aggravates, so when it aggravates, that is manos dosha, when it aggravates, what happens? The bodily doshas, that is vata, pitta, and kapha will get aggravated. So only it is being told that the dhriti smriti vibramshaha karma yat kurute ashubham prajnaparadam tam vidya sarva dosha prakopanam. So it is being very well said in the shloka. Coming to the next point, link of the sharira dosha and manas. So vata is equal to sattva. If you feel the vata nadi, okay, then sattva is okay. If you see the pitta nadi, then okay, then rajas is also okay. Kapha implies or is equal to tamas. So the medicine in microdosing. So why I am stressing this? Because many of the Ayurvedic doctors, majoritarily, they give to the vata, pitta, and kapha, where you have to give in a larger dose. You can see manas is very sukshma guna. If you give a larger dose, it will be affecting the vata, pitta, kapha, not the sattva, raja, and tama. However, I can understand that later on in the next phase, or indirectly, it will affect the manas dosha also. But there is one more technique evolved by seeing all the homeopathic. What I was doing was, I started to reduce the dose day by day. Since 10 to 12 years, this experiment, this research came on, going on. So whenever I felt the patient giving 15 ml of kashaya, it aggravated the things. So when I started to decrease the dose, the aggravation of the doshas or aggravation of the disease condition kept on reducing day by day. So I reduced so low that now to a patient I give only 1 or 2 drops per day, finished. So I feel the nadi, whether this medicine, to how much length of time it will act. I have got an idea. So with minimum dosage, minimum side effect, so with larger effect, where we will be able to control the manas in a more magnificent way. So only the microdosing concept has been discussed in my YouTube channel. You can just go through Dr. Joseph Joy, where a series of classes and PowerPoint presentation have been put forth to you for your better understanding, because it's very low cost, low budget, very few medicines are only required, but having a greater amplitude of results. So yesterday, one of the doctor from Marmakale group had come to me. I will not tell their names and all. So she was having one side depression of the head. Like, however, she was not aware of it. I have told her, see, this side is very low and this is very much high because of our thinking process. So after the treatment of 1 drops of medicine, the condition started to change. The swelling reduced, disc, whatever it has been, swelling was there, the alignment was missed, so it was getting corrected up to 10 to 20% immediately within 6 minutes. So later, after the treatment, she was able to walk more freely, more better than for what she had come for me. So now I would like to ask you one question. If it is so fast, why not we adopt this principle in our practice, so that it will help our patient also and we get very good results also. And one more thing, what I would like to tell you is that why doctors are called as Vaidyo Narayano Hari, means that it is our responsibility to change the negative feeling or bad thought habits of a patient and take him to a better personality. So only it is when called as Vaidyo Narayano Hari. So you know one thing, why they have given so much stress to the Vaidya, means only Vaidya can give the assurance that you will be healed. That is Dhanani Anekani Santi. There are many kinds of Dana. That is one among the famous Dana is Bite Bishcha Abhaya Dana. That is those who are afraid, don't afraid. Telling this thing is the most efficient and very like an energizing type of Dana. So coming to the point, so like it's like treating gastritis. For example, I am telling, if a patient comes to you suffering from gastritis and you give any medicines from any system of medicine, and if you are not able to control his krodha, and if you are not able to tell him that because of your angerness you are creating hyperacidity, the more of hydrochloric acid is being produced in your body, if you are not able to tell that, and if it keeps on going, the patient never get what? Cured. Because one thing you have to understand, the correction of behavior is very much essential to cure any disease, or else you will be only symptomatically reducing the things. This is what Samuel Hang, the homeopathic Janaka, that is the founder of homeopathy, wanted to tell you. The flower batch medicine, what he wanted to tell you, and most of the Ayurvedic principles that wanted to tell you, and all the things like acupuncture, dawn therapy, all the things that we want to tell you that treat the manas rather than a disease. Disease is a problem or symptoms of a complication, that's it. But it's not the real cause. The cause is in the manas. So treat the manas. So till now, any doubt, please, you can ask. Yes, Dr. Surya Ramesh, you are having any doubt, please.
Yeah, I was asking, you're examining the Brahmarandra. Is that something part of Nadi Pariksha, or is it just that I don't know much about Nadi Pariksha, although I do a very, very basic knowledge about it.
Okay. So I will tell you. See, Nadi Pariksha will take you to a situation or a position where you are linking yourself with the patient's manas. That is the first thing.
Okay.
So linking of the software. So if he is feeling a thought process of suicide, I will be able to tell. If patient is falling in love, like 6 months back, one lady came, maybe 16 to 17 years, I think. She was actually suffering for asthma, and for what she came to me. And I asked her, "Are you fell in love?" So she was really astonished. Her mother also was there. Okay, so don't tell, how did you tell him? No, he can understand. So it means that, so what are the feelings that patient is experiencing, if we are able to feel, then that is called as Nadi Pariksha. So each and every organ starts speaking to us. How are you just feeling by only one pulse in only one hand, just feeling like this. How is heart? How is your mind? What you are feeling? You need not to feel all the things, both the hands, and also as you like before and all, I used to feel everything, all the nadis, classical, everything. But when I understood there is a link between our manas and patient's manas, if you are able to link it up and if you are able to speak it up, and definitely it will respond to us. It keeps on, just like you ask some question in your mind and reply for an answer. For example, I will ask, what, how is your mood now? It's very regular rhythm. Okay, fine. So it's very beating, very much speedy. Sometimes depression, sometimes hard. So it gives that something is going in his brain, and he's really want to do something. That could be a possibility of suicide case. Okay, so in the same way, the waves will give you such a thing in your mind process that this is something like this. So if you want to attain this type of accuracy, you have to practice, understand. It goes on. So it's not a one-day job. So anyhow, I have given many recordings of Nadi Pariksha, what are all the types and everything in my YouTube channel. You can go through that. Many classes. Only around about 100 and more videos are there only of Nadi Pariksha itself. You can go through that.
Wow.
What is Pitta,
Yeah,
Kapha,
thank you so much. It
associated.
opened another door. So
Of-
what you're trying to say is, before it manifests in the body, it is already present in our aura. And yes, okay.
brain. Yes.
Thank
Very
you.
good. Super. Very nice. So this is what I would like to tell you. Next, coming to the treatment. So we are understood the brain, and we have to understand when it starts in the brain, it affects the spinal cord by structural changes. It affects the organs, physical, chemical, and also functional changes will be there. So in this way, however, it starts from the manas. So we have to do some treatment to the whatever the changes it has been happened to our body. Now, what are the treatment? Now coming to 3 steps to tackle. So one thing, to tackle the manas, we have to use microdosing. That is Ayurvedic principle itself. Whatever the mega dosing you are going to give, the same thing in microdosing. You mix Asava, Arishta, then what you call Basmas, Churna into one form, and add a activator. That's what my preparation called as Ayur Homeo preparation, that is called as activator, which will energize all the medicines into it, mix it, and feel the nadi and give it. And nadi will tell you whether it is acting or not. Just before I am starting this class, one patient of maybe 5th standard girl came to me. Her mother was telling that every time she does stomach pain. The same thing, I felt her stomach, it was tilted to the left side itself. So what I have done, I had done nothing, just gave the drops. Within seconds, maybe 1 or 2, 3 seconds, the pulled up stomach came back to its normal stage. That is whatever I think, that is the software. How I process the medicine, that is the software. The thought process will be going into the medicine by my thoughts, so that whatever I feel, what has to be happened after I instilling the drops into their mouth, 1 drop, I tell once more, this medicine, as I have added Pippali, you have to increase the pitta in your body. So as I have added Asti Shrinkala, that is sizes quadrangularis, so the absorption of calcium should be more. So you should be very choosy, so that whatever comes into your digestive tract, you should absorb it. So most of the time we give calcium supplementation. Okay, it's very good. But you have to understand one more thing. It's not the calcium deficiency it's making our bone weak. Rather, it's the selective absorption criteria. What has to be absorbed is the intelligence of the brain and the gut flora and the stomach, but not what you give the tablet may be absorbed or may not be absorbed. So what you have to activate is that the intelligence of the brain, so as to take whatever you have taken, it has to be absorbed into your system. So if you activate this much, the cost of medicine and everything will be very low, and patient gradually will coming and picking up his capacity. For example, the whatever medicine you give, one thing you have to understand, it will reduce his appetite. Am I right or wrong? If you give calcium, vitamin tablet, whatever the tablet you give, whatever the medicine you give, it will reduce the appetite, because you have to understand one thing, all the disease is caused by low pitta. That is, according to the Manas, low, that is Rajas. So if it is so, when the patient is depressed, you cannot give him biryani or mrustana bhojana to eat, because however he is very much hunger, when his depression is very much high, he will not be able to eat. So when pitta is low, that's what. Now you have to activate the pitta so that whatever it comes, so that it get digested. If this principle is adopted, it will be very easy. I'm not against it, because in certain condition, we have to give vitamin supplements, calcium supplements in the case of emergency. So where what to use, that is your ideology to think, not in the functional changes. When it comes to the anatomical changes, when it is an emergency, please do it. So I'm not against any system of medicine. I'm just telling you that where to use these 5 systems, in which condition, how you can act accordingly. That's what I mean to emphasize you. Getting the point? So you have to understand one principle, means you have to study all the system of medicine, understand how they think, how they do it, and then only you can come into a conclusion that, just like has Kuempu Kavi, one of the famous Kavi in the Karnataka, he told, Yella matava hotta turi, whatever the negative things in all the dharmas, you just leave it. Whatever the positive things, you get it, you take it and imbibe into it. In the same way, you have to study all the system of medicines, understand, analyze, so which tool has to be used and in which person you use it. So you'll get a good results and better results. And coming to the spine issues, it's very much important where to increase the space. So I think you might have seen in the X-ray the knee joint space is very much reduced, or the vertebral space is very much reduced. So how to increase the space now? First thing you have to understand that why the space has been reduced. First thing, if the space has to be reduced, there is a nerve compression. Okay, if because of the nerve compression itself, what will happen? For example, take the knee joint, osteoporotic changes in the knee joint where space is reduced. So there will be compression at the level of L1 to L5, whichever the level that could be, you can assume. So because of that compression, usually left side of the leg starts for 90% of the patient, left side is weak. You have to, I have seen many patients coming to me with the disc slip, knee joint pain, backache, everything I just analyze. Left side, wholesale, 90% is 100% weak. So what is really happening? There is sacroiliac joint irregularity, compression in L1 to L5 levels that causes in turn what you call sinking of hamstring. So first sinking muscle is called hamstring. So then later on comes to gastrocnemius soleus, and later on it comes to the front side of the thigh. So when I analyze these things, so what is happening? As the muscles is weak, hamstring is weak, the femur bone comes an inch downer, and the tibia bone comes upper, so that the space keep on reducing. Now what you have to do is that relieve the compression in the L1 to L4 level and activate the muscles by acupuncture. Open up the space by HVLA technique. That is a beautiful, amazing technique where you will be able to open up the space. Okay, high velocity, low amplitude technique this technique has been vividly or very much used in osteopathy, chiropractic and all. And the same way, if you want to reduce the space, just like you are opening up the leg and closing it. In the same way, if you have to understand HVLA technique to open up the space, and Dawn therapy, that is a German technology to close up the space. When if you are opening and later you have to close it up. So you have to understand where to open and you have to close. So if that is done, the structural changes to an extent, that is like alignment part. I am speaking about alignment part, that will be 100% ruled out by these two techniques. And yeah, given acupuncture, put the needle to a point where we have to get regenerated and where the point is recessive. In the same way, if the brain, as you think that, start feeling the brain, where there could be some burrow, there could be some ridges, there could be some elevations changes, that gives a doubt that yes, there is an atrophy of, or one thing, there is hyper use of brain or low use of brain. One is sinking or hyper use. Both are also problematic itself. Okay, so usually ourselves, like right part of the hemisphere are being mostly used by all the persons, without any gender difference. I have observed that mostly right side of the right hemisphere is being usually used for Kama, Krodha, Mada, Matsarya and all. This is my personal experience I am telling. It's not anything anymore, any books and all, you will not be able to find it and feel it. So what is happening? Contrary part of the left side starts to weaken. So left brain is controlling our right part, so it is very much strong. So the harmony between left and right brain is not being maintained. So what happens when this process starts? No, you can feel the occipital area. In some person, it will be full flat, sometimes ridges, screws and all. So that we can understand it has been affecting now the balance of the person also. So the locomotor system has been also affected. Just by feeling the brain and spine, you'll be able to understand what is the condition. And if you want to feel how the organ is, just we can feel the nadi and understand how the organ is. By just feeling the nadi itself, you can understand the brain, spine, everything. That is another question. But definitely, when it is very easy to feel the brain itself, then why you are worrying about nadi to feel those things? Okay, so organ level nadi is very much essential. So what I have told you. So now what I have told you, are you able to understand this much things? Any doubt in this? Dr. G? Dr. Surya Ramesh, any doubts? Anyone? Okay, so now coming to regeneration. Ayurveda has emphasized on regeneration therapy, that is Rasayana, regeneration, how to regenerate our nerve cell, tissues, organs. It's very well explained in Charaka Samhita. So by doing Panchakarma and later on taking some good Rasayanas, like if I tell Chyawanprash, there could be more of what you call adulteration possible. If it is really Chyawanprash, 100%, after doing a Panchakarma procedure, it is very much helpful to regenerate the tissues and all. So that could be imbibed or practiced. So so what I understood in the brain mapping technique, wherever there is a depression, put one acupuncture needle, and counteract part, that is, if that part has been weakened and the counterpart of legs, hamstring has weakened, feel the muscles, and where the muscles is not really formed, when there is a depression in the muscles, what should be done? So at that time, prick one needle there and give an electrical stimulation. First, you have to give the you get different tuning force of different hertz. You can just vibrate it and put it in the head or the leg. So the nerve regeneration will take place. If not, otherwise, if it's not been activating by that, you can use the electrical stimulator of varying hertz, you will get it. So you can use that. So I have seen that the coma patients also getting retrieved by this. So after the treatment, GB syndrome patient used to be taken, carried out. So within 10-15 minutes, they are able to walk. So I'll measure what is the circumference of the muscle before the treatment. After the treatment, say about 10-15 minutes, so it will increase its size up to 0.5 to 1 centimeter or 2 centimeter also it get strengthened. So it will be just like magic every day in the clinic. So they come by severe knee joint pain, backache. They go by, fine, I'm not having any pain at all. So by ensuring all the terminology, all the techniques, what I have given to you, it will give a fullest possible effect to control from manas to the bodily affected things. So if the renal calculi patients, staghorn calculus of patient had come to me many times, so I have fixed the kidney related nerve in the spinal cord, and I have given microdosing in Ayurveda, that is the composition of Nyandukalbasam, that is a Siddha preparation. I use many preparation. I prepare my own medicines. Okay, so we in Chikmagalur, it's very much a vast area. All the herbs we get over here. So it's very easy to prepare the medicine and understand the psychological prabhava of the medicine also. So if you see a plant, you'll be able to understand this plant is for this thing. You need not understand anything. By seeing itself, you will be able to get it. So there is a link between a human and plant also. It's not possible for me. It's possible for everyone. Those who are residing over here. It's simple thing. It's not a big thing. So everyone can do the same thing. So that is the relationship between nature and the humans over here. So and the same way, the knowledge of Marma gave me a larger effect. How the where the air resides, how that could be stimulated. So based on all those things, I have come into a conclusion that it's very essential to learn this technique, or else we are moving the patient from what a greater and graver disease, because we give painkillers or whatever the things, whatever it comes into our mind, we treat it. But it's not, it should not be like that. It's not whatever coming into the mind, what is happening. To understand what is happening, first thing you have to learn the Nadi Pariksha, and the same what are Dawn therapy and osteopathy, Marma treatment, Tibetan Marmam, ozone therapy. So which we can collaborate with the different systems of medicine, and we'll get a beautiful and amazing result. So I will be keeping workshop maybe in future, maybe 2-3 months. So where there will be an opening of my hospital. It is an integrated hospital where allopathy doctor will be there, and myself, and all the varieties of treatments all over the world, which will be incorporated in a small town called as Balehannur, that is in Chikmagalur district, Karnataka. So you can come over here to learn all those techniques, and you can learn and you can go. So this is the thing that which I would like to tell you. So thank you so much. Any question? You are welcome.
Very interesting. I'm curious about what is this Marma that you're talking about, sir?
Yeah, Marma is a martial art techniques, colorified technique. The Marma guru was training, like, beating. If the patient goes unconscious, retrieving within seconds. So beating, retrieve him. That's the technique. Here we are not beating, so just retrieving. That's it.
Yes, you are a Vaidya, so you have to give the life. You can't take a life. So Marma would be those gentle touch points at different places.
Because
or is it also involving different energy points and
of course. Vital points where Vayu resides. So any more questions?
Okay. So this is very close to the technique that they call Varmology, sir?
Yeah, Marma? Same. Marma is same thing.
Same.
Yeah, everything is same. Yeah, I have got quite a few videos of Marma also. You can go through my YouTube. Explanation, history, everything. It is my YouTube.
I am also a practitioner of Varmology and Marma. So I asked if it is the same, because in the north the practice is called slightly different from what it is in the south.
It differs from if I have been experienced doctor, what I practice will vary from your practice, because my understanding level has been changed, and the application also will change. That's it.
Yes.
No matter, the points are same.
The source is the same. Yeah.
Yeah. Of course. Yes. Any more? Or else we will